Good evening, everyone. Okay. Today we will read like sulfur. Okay. Sulfur, one type of element, and first we will talk about the introduction. An introduction mentioned in the lectures on homeopathic materia medica, and this is written by James Tyler Kent, and this was published in 1904. What Dr. Kent has said about the sulfur? Dr. Kent has said sulfur is such a full remedy that is somewhat difficult to tell from where to begin. Means, if you want to prescribe, you cannot think from where we should begin. This sulfur. And sulfur is a ragged philosopher. This is said by Herring. Why? Because this patient is like sulfur, a scholar, and that patient is like an inventor. He will working day and night. And if the person is working day and night, he will having a long hair, uncut hair will be there. And this patient is a sedentary lifestyle. He will be confined to a room. He will be not going outside of the room. That is a sulfur patient. A sulfur patient is a lean, thin, hungry, and dyspeptic fellow with the stooped shoulder you will find, according to the James Tyler Kane. And this patient is having a philosophical inquiry you will find. Okay. Then sulfur patient is like he doesn't like a cleanliness. He never, for the sulfur patient, he doesn't like the cleanliness. He wants that work. He will be working day and night. What he want to do, he will be definitely doing. Why? Because overthinking is there. Because philosopher is there. Because ragged philosopher is there. And the word ragged philosopher, which is said by Constantine Hering in his book. The name of the book is Hering, Guiding Symptom of Our Materia Medica, which is written by Constantine Hering. But if you're talking about the Hering, this point I will correlate with the pharmacy. Dr. Constantine Hering has given the scale of a potency. Which scale is given by Dr. Constantine Hering? Can anyone tell?
Decimal scale.
Yes, very good. But if you are talking about the decimal scale, now we can talk about the centesimal scale. Who has given?
NMN.
Yes. But if you are talking about the centesimal, now we will talk about the LM potency. Who has given the name of LM potency? Can anyone tell? A 50 millisimal potency is there. Can anyone tell? That is given
Millisimilar
by,
Pierre
Perry
Smith.
Smith.
yes, Pierre Smith. And that LM potency is also known as Q potency. So can anyone tell me Q potency is given by whom? Can anyone tell?
Kunjali भैया.
Ha, yes, very good, Hina. That is Kunjli Jost. Okay. Now we'll talk about the common name. That is brimstone and flower of sulfur. And this medicine is prepared under class 7. If you're talking about the class 7, mostly the carbon group is prepared under class 7. Just try to remember. Okay. Mostly element and carbon group that will be prepared under class 7. Element and carbon group. Okay, just try to remember. Mostly. Okay. And this medicine is proved by Dr. Christian Frederick Samuel Hahnemann. Now we'll talk about the symptoms of sulfur. Adopted to the person of a scrofulous diathesis, subject to venous congestion, especially of a portal system. You can see a person is having a scrofulous glandular affection is there over the throat. And what is the meaning of diathesis? Can anyone tell? What is the meaning of diathesis? Can anyone tell?
Disposition, sir.
Yes, very good. Disposition means tendency to occur a same disease condition after getting a cure. Like we can take the example, okay. Like suppose if the person is coming to you and that person is suffering from the renal stone and he has taken few medicine and after few months he got cured. But again he will develop renal stone. Why? Because this patient is having a lithic diathesis, tendency to form a renal stone. Okay, so we can say this patient is having a lithic diathesis. So similarly, you will find scopular diathesis means the person is suffering from the glandular infection, affection. Like we can say, if the parotid gland is there, the person is suffering from the mumps. If there is a thyroid enlargement is there, then we can say the patient is having a scopular diathesis. And if we are getting this type of symptom, then we can think about this medicine. Another symptoms for lean stoop shoulder, person who walk and sit stooping, walk stooping like a old man. Suppose if the patient is coming to you in front and that patient is standing or either walking, just look over the upper part of the body. You can see in the first picture, this is the normal one, and if you will look the upper of the part of the body, you will find there will be a concave like posture. If you will see from the side, you will find like C type like you will find C type like back V you will find. That means the patient is having a stoop shoulder. And why this patient is having a stoop shoulder? This point we can correlate. Like in our bodies, sulfur is having essential for the protein synthesis. And if there will be a low sulfur, there will be a problem related with the protein synthesis. And this sulfur is also having relation to the metabolic problem. And if there will be a metabolic problem is there, so there will be a problem related with the calcium. If there will be a calcium problem, so there will be a weakness of bone. And because of weakness of bone, the patient will be having bending of the spine. That we can say this patient is having weakness of his spine, if, and that will lead to the stoop of a shoulder of the patient. But if you're talking about the stoop of a shoulder, that we can correlate with the different medicine. Can anyone tell what are the medicine for the stoop shoulder?
Phosphorus also.
Yes, phosphorus is there, and one more is there. Can anyone tell?
Calcarea, Guru,
Not,
Calcarea.
not calcarea. That is coffea. Coffea cruda is the medicine. But how we will differentiate? Suppose if the patient is coming and that patient is having a stoop shoulder, then we can correlate. Like sulfur is having a desire for the sweets, and that will be a ragged philosopher, and dirty filthy will be there. That is sulfur patient. But if there is a phosphorus, phosphorus is having a desire for the juicy and fruity things you will find. He will like the cold things. That is phosphorus. But when we will think about the coffea cruda is there, but you will find the unusual activity of mind and body. Always he will be doing or thinking something. And that patient, if the patient will become so much happy or excitement, so there will be a no sleep. And especially you will find in case of a coffea cruda. Okay. Another point is there. Standing is the worst position for sulfur patient. They cannot stand. Every standing position is uncomfortable. I've already told if there is a problem related with the sulfur and sulfur function, especially related with the metabolic system, okay. And if there is a problem related with the calcium, so there will be a low calcium in the body, so it will causing a weakness of the bone and weakness of muscle. It is also related with the metabolic disorder, and that will causing standing is the worst position. So the patient cannot stand for a longer period of time. Once he will be standing for a 5 minutes, so there will be a problem. But if you are talking about the standing is the worst position, now can anyone tell me the name of medicine where the patient is getting relief by standing position? Can anyone tell? In which medicine mention standing amelioration? Can anyone tell? कोई बताएगा? Amelioration standing. There are two medicine. One is Conium maculatum, another is Bactis tinctoria. These two medicine is mentioned synoptic due to the Materia Medica, which is written by Cyrus Maxwell Boger. Just try to remember, okay, these are the two medicine where the patient is getting relief by standing. Okay. Another symptom is there. What I have already said. This patient is having a ragged philosopher, and this patient is very dirty. He never thinks about cleanliness. He will be means cleanliness is not a great idea with the sulfur patient, and he thinks it is not necessary. He is a dirty. He doesn't see that necessity of putting a clean cloth, clean collar. He will be always looking for. He will be always giving priority to the work. Like we can say, we can correlate with the science, a scientist, especially if the scientists, those people who are working as a scientist, they will be never thinking about his own body. Even he will forget all the things. They will be working day and night like a sulfur patient. So similarly, you will find this type of look. You will find there will be a long hair. You will be find uncut hair. You will find. And there will be a long beard, you will find a dirty face, you will find because this patient is not taking bath. And this patient is an overthinker. He will be always thinking. Once the one idea will come in his mind, he will be always follow that. कोई भी बात अगर दिमाग में आ गया कि मुझे ये करना है, definitely he will be doing that things until he will finish. He will not leave the things. Okay, that is a sulfur patient. So this patient is also having aversion to being bath. Being washed, always aggravation after a bath, and too lazy to rise himself, too unhappy to live. And that patient is having a sedentary life, what I have already said. This patient is always confined to the room. Then, this point we can correlate with another medicine. In which medicine there is mentioned, like aversion to wash or aversion to take bath, can anyone tell?
Imodium
Which medicine?
crudum.
Yes, anti-crude is the medicine. Very good. Another symptom is there. Children cannot bear to be washed or bathed. You can see the patient is crying in the first week. Once the mom will ask to the child, go and take bath, he will be starting. This patient, sulfur patient, because he doesn't like. And once if he will be taking the bath, he will aggravate the symptoms. And if the patient cannot take bath, especially in the cold water, the medicine is anti-crude. And this patient is having a big belly. You can see big belly. Okay. Already this sulfur, role of the sulfur in our body, which is related with the protein. If there will be a low sulfur, so there will be a no protein synthesis. And if there will be a no protein in our, when protein synthesis is not there, then the problem lead to the PEM, protein energy malnutrition. Means there will be a problem related with the PEM. And if there is a problem related with the protein energy malnutrition, so the patient will be suffering from the marasmus and kwashiorkor. And if there is a kwashiorkor, so patient will be having a big belly. Like this patient is having a big belly. And you will find there will be a thickness and whole body thin will be there. But what is the difference between kwashiorkor and marasmus? This point we can correlate with the practice of medicine with a disease condition like kwashiorkor and marasmus. This marasmus will be always looking like a mara hua. M for mara hua, M for marasmus. But that patient will be very active. Okay. So from there you will get a question. Pantyfleckicine generally क्या होता था? In like 4 or 5 years before, some people were wearing the low waist jeans. Okay. So in the back portion that pant will be floating. Similarly, you will find the back muscle like gluteal maximus. There is a problem related with the pain, protein energy malnutrition. So that muscle will be hanging from behind, and that is known as pantyfleckicine. Sometimes this was a question has been asked. in the exam, like 4 to 5 years before, pantyphlecism you will find in which disease? So answer will be that marasmus. Okay. And in this condition, you will find big belly. Why? Because this patient is having a hepatomegaly, and that will lead to the obesity of the patient. Okay. So this is the basic correlation. But if you are talking about the disease, so can anyone tell me the name of repertory where we will find the rubric by the name of disease? कौन सा ऐसा रिपर्टरी है जिसमें डिजीज के नाम से दिया हुआ है? कैन एनीवन टेल?
एसके
Synthesis.
पाठक रिपोर्टिंग
Yes, very good. Synthesis repertory, which is written by Frederick Squires. So, where you will find by the name of disease like quasiorcus, marasmus, PCOD, hypothyroidism, you will find direct rubric by the name of a
पाठक
disease.
में भी तो
Yes, very good. If you are talking about the Fatak repertory was the first time came in 1963, which is containing three grade and containing a 393 medicine. Okay, just try to remember this point. Okay. Another point, sensation of burning on vertex and smarting in eyes, in face without redness of vesicle in mouth and dryness of throat, first right, then left, in stomach, in rectum, in anus, itching, piles, and scalding urine, like a fire in repel, and in chest, rising to face of a skin, whole body with hot flashes and a spot between the scapula. Suppose if the patient is coming to you and that patient is telling I'm having a burning over the vertex, but this point we can correlate with a practice of medicine with a disease condition. Like if the patient is having a scalp dysesthesia, so the patient will be having another condition is also there, like occipital neuralgia is there. In that condition, you will also find there will be a burning over the vertex. Okay, and if the person is having a stress, again you will find burning in the vertex. Okay, so these are the condition which is related with the practice of medicine where we will find burning over the vertex. Okay, but this point we can correlate with the Materia Medica. There are certain medicine which are also mentioned burning over the vertex. Can anyone tell what are the medicine?
Sepia.
Burn in
Veratrum.
ग्रेफाइटिस
Yes, sepia, someone said, okay. If you're saying sepia, in
ग्रेफाइटिस
case of a sepia, there is mentioned sensation of coldness over the vertex, not hot. I am asking burning over the vertex. What are the medicine? Burning over the vertex. और क्या medicine है? There are medicine.
Calcaria. Silesia.
Calcaria is there. Calcaria is there. Graphitis is there. Sulphur is there. Okay. And someone said veratrum. Veratrum is also having cold sensation over the vertex. And valeriana is also there. Okay. So generally we can think if the person is suffering from the spinal problem. Suppose if the patient is coming to you and that patient is having a herniated disc is there, especially in the spine. So the patient will be suffering from the burning between the scapula. But these symptoms we can compare with the phosphorus. If there is a burning between the scapula, okay, then we can think about phosphorus is also there. But we have told, like in phosphorus, you will find there will be a desire for the juicy and refresh fruity things. Okay, but in case of a sulfur, you will find desire for the alcohol and desire for the fat and desire for the sweet. You will find okay in case of a sulfur. But if there is a cold sensation between the scapula, which medicine we can think? Can anyone tell? Sensation of coldness between the scapula, which medicine we can think?
Abyss.
What? Not abyss. Not abyss. In abyss, there is written. What written? Abyss canadensis. You want to say abyss canadensis? Let me tell you. There is mentioned sensation as blood where ice water. ऐसा लगता है उसका खून एकदम बर्फ की तरह बन गया है. Then we can think about Abies canadensis. This is also known as Pinus canadensis, and that is also known as Spruanus canadensis. But I am asking sensation as if coldness between the scapula. Scapula के बीच में coldness
कालिका
होगा. Not Caligar. That is the medicine. That is Lacnanthus. You will find in the phosphorus. In bracket, you will find Lacnanthus is the medicine. Okay. Lacnanthus is the medicine. But if you're saying Calicar, we will find there will be a backache and sweating is there and weakness we will find. If the patient is walking, so he will sit and he will take rest. Okay, that is Calicar. Okay. Another symptom is there, bright redness of the lips as if blood would burst through. You can see there is a redness of the lips you will find. The patient, if the baby is coming to you, just try to look the face of the baby. You will find, and according to the James Tyler Kent, you will find there will be a burning over the vertex, but especially in the daytime, not daytime, especially in the night time. But if there is a, you will find lower part will be coldness, but it will be especially in the daytime. This is said by James Tyler Kane, and it is mentioned in his book. The name of the book is Lectures on Homeopathic Materia Medica. Okay, for these symptoms, can anyone tell me another medicine? In bracket, there is mentioned another medicine. Can anyone tell? That is tuberculinum. Okay, but tuberculinum we can correlate. Okay, like tuberculinum we can correlate with the Kent repertory. Okay, so how we can correlate? In Kent repertory, like the Kent repertory first time, this was published in 1897. The second volume came 1908. The third volume came 1924. Okay, and this Kent repertory is containing 37 chapter. Okay, this Kent repertory containing 37 chapter, which is starting from the mind, ending with the generative chapter. So we can correlate with in I chapter you will find stigmatism is given. Under stigmatism, single medicine is mentioned tuberculinum. So there is a question. Sometimes the question will come in our exam. Okay, like stigmatism. For stigmatism, single medicine is mentioned in Kent repertory. There will be option like ruta is there, basilinum will be there, tuberculinum and sulfur. So answer will be tuberculinum. Okay, so we have correlated from these symptoms. Okay. Another symptom is there, weak, empty, gone or faint feeling in stomach about 11 a.m. or 10 a.m. and ambulation from eating. Why this patient? Because this patient will be working day and night. Okay. And this patient will be having so much hungry. He will be always asking for, Mummy, food, 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 food. Once you will provide the food, he will load up. Means uska पेट ही भर जाएगा. He will eat little bit and he will say, I am not having more. Okay, I cannot eat. And this patient is drinks much water, it's little. कहते हैं ना कोई कोई पेशेंट होगा, देयर विल बी अ फ्रेंड और फ्रेंड भी होगा, बैचमेट्स भी होंगे. Those patients who are eating little and drinking much water, then we can think about sulfur. And this is mentioned in the boric materia medica. Okay. And this patient is having a constipation, stool hard, not dry as if burned, large painful, child is afraid to have. The stool on account of pain or pain compels child to desist on first effort, alternate with the diarrhea. Miss, you can see in the picture the expression of the patient or baby. Why the patient is putting the hand? Because this patient is crying. Why? Because this hardness of stool is there. And it is naughty like very hard. If the word is mentioned naughty, means very hard. There will be a so much problem while passing the stool. And that much pain is there. In the next time, the patient will be having afraid of having bowel movement. From next time, he will start and he will afraid to pass the stool. He will be not passing the stool. And I want to tell you, there are two cases when I was doing clinic in my place. Okay, there was a patient. Like he came and he was saying कि मेरा बच्चा है and he is having a age around 3 to 4 years and he is not passing his stool. Once he will be sitting, he will start crying. Then I remember this symptom. Child is afraid of passing the stool. Why? Because of hardness of stool, because of not a stool. And then I prescribed sulfur for 3 doses and that patient was completely resolved and he got cured. So this was the symptom. Once you will remember the symptoms, then you can correlate with your patient also. Okay. And you are finding constipation alternate with the diarrhea. Okay. And this point again we can correlate with the cane repertory. And similar symptoms was has been asked in the previous, like yesterday exam. There was a question related with the diarrhea. Okay. And this point we can correlate with the cane repertory. Under which chapter of cane repertory we will find constipation alternate with diarrhea? Can anyone tell? We can correlate with the rectum. Okay. And the rectum chapter you will find. Okay. Just try to remember. Another symptom, the discharge of both urine feces painful to pass over which it passes large quantities of colorless urine, parts around anus red and excoriated. All the orifices of the body very red, all discharges accrete, excoriating whenever the touch. Means, and because it's causing excoriation of the parts, and scalding. Generally क्या होता है? This will be very warm and it will causing the scalding. क्या होता है? ऐसा लगता है छिल जाता है, and that's why this patient is having so much pain, especially while passing the urine. But if you are talking about passing the urine, if this point we can correlate with the cane repertory, passing of cold urine, which medicine? Can anyone tell? Can anyone tell? Passing of cold urine, which medicine? Agaricus is there. Okay. But if there is a passing of cold stool, the medicine is nitric acid. Okay. So just try to remember. And this medicine, we can also think menorrhagia has not been well since her last miscarriage. If the patient is coming to you and that patient is having a menorrhagia, what is the meaning of menorrhagia? This point we can correlate with the gynae and obs. What is the menorrhagia? Can anyone tell? What is menorrhagia?
Heavy menstrual bleeding more than 8 days and more than 80 ml.
Yes, very good, Brain. So, if the patient is coming to you and that patient is having a misbleeding more than 7 days, especially 7 days, according to DC Datta, okay, more than 7 days, then we can think about this patient is having menorrhagia, and that menorrhagia is not well from last miscarriage, then we can think this medicine, and this medicine we can prescribe if there is a new moon, then we can prescribe a single dose of this medicine, then it will got cure. Okay, and this is said by Dr. Lippe. You have to remember the quotation. Sometimes there will be a sometimes you will find all symptom and they will ask who has said. Okay, but this is said by Dr. Lippe. Okay, just try to remember. Another symptom is there, boils coming in crops in various parts of the body. A single boil is succeeded by another as soon as first is held. Okay. The link will be open after some times. Again, you have to join the same link without any delay. Okay, without any delay. Okay. So, suppose if the patient is coming to you, so you can see the patient is having a boils. Okay. And that boil is coming in crops. क्या होता है? एक साथ 3 to 4 boils will be appearing over the body. Then we can think about this medicine. And one boil is getting cured, another will be appear. Okay. And these symptoms we can correlate with the another medicine that is known as leopard's bane. That is also known as mountain tobacco. Mountain tobacco. The name of the medicine is Arnica montana. What is mentioned in Arnica montana? There is mentioned tendency to appear or tendency to appear one after another while appear one after another. एक ठीक होता है दूसरा आ जाता है. Then we can think about the Arnica montana. But these symptoms again we can correlate. Like suppose if the patient is coming to you and that patient is having a boils in crops over the face and which is contained green pus, then we can think about the medicine. Can anyone tell which medicine?
Sickle core.
Sickle core in the bracket. Tuberculinum is the medicine. Okay. So we can think about the tuberculinum. And skin, itching, voluptuous scratching. Ambulation feel good to scratch and scratching causing burning and aggravation from heat, weight and soreness in folds. Okay. Suppose if the patient is coming to you and that patient is having a skin problem, but there is mentioned the word voluptuous. Voluptuous. What is the meaning of voluptuous? Can anyone tell? Voluptuous. The word voluptuous means that means the patient is getting a sexual gratification while scratching the skin. Means he's he will be somewhere while scratching. He will be feeling sexual pleasure. That is the meaning of voluptuous. And this voluptuous we can correlate with the organ of medicine where Dr. Hanman has told about the Sura. Can anyone tell me the name of number aphorism number? Can anyone tell which aphorism?
80.
Yes, under 80, Dr. Hanman has told about the Sora. Okay, in the footnote you will find Sora is a hydra headed. Okay, so he has mentioned about the Sora aphorism number 80. Okay, so this was the correlation with the organ of medicine. Okay, and this patient is having problem especially while there will be a scratching. Scratching provide relief and providing voluptuous itching, but it will causing so much burning. Okay, and this point we can correlate with another medicine. Suppose if the patient is having dry itching eruption and that patient is getting relief by cold application, can anyone tell which medicine? Dry itching eruption which is getting relief by cold application. Can anyone tell the name?
Anti-food?
Not antincrude, that is phagopyrum. Phagopyrum is the medicine. Okay, phagopyrum is the medicine. But if there is a skin problem is there and that patient is getting relief by warm application, which medicine we can think? Warm
Arsenic.
application. Yes, arsenic is there, but main medicine is what? Arsenic we can think, yes, but there is another remedy. That is Rus veneta is the medicine. Rus veneta. Rus veneta. Rus veneta is the medicine. Another skin affection, dirty and filthy. Okay, and similarly, skin affection that have been treated, medicated soap and wash and hemorrhoids that have been treated with the ointments. जैसे कि अगर कोई पेशेंट आता है और बहुत लोग को स्किन प्रॉब्लम हो रहा है एंड दे आर यूजिंग द ointments and soap and they will get suppressed, then we can think about the sulfur. Sometimes a person is suffering from the hemorrhoids. Okay, hemorrhoids से suffer कर रहे हैं and they are putting the ointments. Then again we can think about this medicine. Okay, chronic alcoholism, dropsy, and other ailments of drunkards. They reform but are continually relapsing. Okay, suppose sorry, suppose if the patient is coming to you and that patient is having craving for the alcohol. Okay, and if he is suffering from any kind of problem, that point we can correlate with the practice of medicine. If the person is having a craving for the alcohol since so many years, then he might suffer from the cirrhosis of liver. In that condition, we can think, etc. There are condition, etc. We can think in that condition. But if there is mentioned craving for alcohol, so there are so many medicine. और क्या क्या medicine? Can anyone tell? क्या क्या medicine है craving for alcohol?
SRM Europeum Nux vomica, Calcarea ars, Sulphur
Ye-
zincum metallicum,
Yes,
Ranunculus bulbosus,
yes,
Syphilisum,
yes. And calculus ars is there.
Sulfuric
Agaricus is
acid.
there. Yes.
Sulfuric acid.
Yes, sulfuric acid, very good enough. And trinitrotoluene is there, Quercus E. glandium is there. Okay. And this point also we can correlate with the Kent repertory. Okay. With mind chapter. Under mind chapter, there is a rubric which is related with the alcohol. So what is the rubric? Can anyone tell?
Dipsomania, mania,
Yes. Dipso or dipsomania and maniaopathy. Dipsomania ये दो रूब्रिक हैं जो कि अल्कोहल से रिलेटेड हैं और ये बार बार क्वेश्चन आता है, ठीक है। Mania of Potu. Sometimes dipsomania आता है कि dipsomania we will find under which chapter of Kent poetry. So answer will be mind. Okay. And mania of Potu आता है, इसका भी मतलब यही है. But what is the main meaning of dipsomania? Sometimes it will be asking. Okay. This was the question has been asked, I think. Okay. Dipsomania means a maniacal desire. Means the patient always he will asking that Mama, I want दारू 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 मुझे दारू दे दो. वो कभी खाने के लिए नहीं पूछेगा, उससे कहिए दारू 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 दारू. That is the maniacal desire for alcohol. That is the meaning of dipsomania. And dipsomania we can think about sulfur and etc. There are so many medicine. Okay. And this patient is having a nightly suffocative attacks. Wants the door and windows open and become suddenly wide awake night and drowsy in afternoon after sunset and wakefulness the whole night. And this patient is having a breathing difficulty, especially in the night. So he will went to the door and he will open the windows and he will open the door so he can take the breath. Okay, and these symptoms we can correlate with the pulsatilla. Pulsatilla is also having a suffocative attack. So she will open the door and she will go outside because in open air she feels much better. Okay, that is the compare with pulsatilla and sulfur. Okay, happy dreams, wake up singing. Okay, this patient is there and you can see in the picture. Patient is having a happy dreams and he will be when he will wake up he will be always singing tujhe dekha to ye jana sanam. He will be always singing a song while he wake up in the morning. Okay, and this patient is always everything looks pretty which the patient takes fancy, even rag seems beautiful. कितना भी गंदा हो, सुअर होगा ना, सुअर भी इसको अच्छा लगेगा. If the pig is there, he will say how beautiful, how she is cute, like he will say like that. Okay, and these things you will find in case of a sulfur, and sulfur is a ragged philosopher. Just try to remember. Okay, at this point, movement in abdomen as of a child. The patient is feeling something moving as if child is there inside the abdomen. At this point, we can correlate with the gynae and ops. Okay, gynae or ops, we can correlate with the pseudocyesis. Pseudocyesis, okay. Pseudocyesis means the false pregnancy. And this was the question has been asked 5 years ago. Pseudocyesis का मतलब क्या होता है? ये 5 साल पहले आया था, I think 2018. This was the question has been asked. Okay, pseudocyesis. Okay, so just remember. But for this symptom, can anyone tell me another medicine और क्या क्या medicine है? Like crocus is there, thuja is there. Similar symptom you will find. Okay, and this is a great Hahnemannian antisoric remedy, and this is known as king of sora. Okay, and abolition of feet and dislike of water, dry hard hair and skin, red orifice and catnip sleep, and always indicate sulfur homeopathically. Suppose if the patient is coming to you and that patient is always saying, Doctor Sahab, I am having short snap sleep. Okay, थोड़ा देर सो लूं मैं refresh feel करता हूँ. Then we can think about sulfur. और दूसरी क्या मेडिसिन है कैटनैप स्लिप के लिए? Can anyone tell?
Phosphorus.
Not phosphorus, that is fluoric acid. Okay, which is mentioned in the boric Materia Medica, fluoric acid, where there is a catnip slip. Okay. Dirty, filthy people prone to skin affection, like what I have already said, and they will be suffering from the skin problem. Okay, and aversion to being washed because they are very lazy to rouse himself. Dirty, filthy, and too lazy to rouse himself. इतना मतलब आलसी होता कि वो नहाने भी नहीं जा सकता and that's why this patient is having aversion to being washed. Okay, and when carefully selected remedy fail to work, especially in acute diseases, it frequently arouses the reactionary power of the organism. We can think if the means if you're prescribing the medicine on the basis of totality of symptom and that medicine is not reacting, then we can think about this medicine. that is sulfur. And that sulfur is very selfish patient. Means he will be never thinking about the others. इतना selfish होता है कि अपना काम बनता भाड़ में जाए जनता. The patient will be saying अपना काम बनता भाड़ में जाए जनता. Means I am doing for my things. Okay. What the others are suffering, I don't have any problem. And you will find every colleges, there are some students, they will be always buttering to the teachers. And similar, they are having the sulfur patient because they will be thinking about himself. They will not think about the others. कि क्या उनको होगा क्या नहीं होगा क्या दूसरे सफर करेंगे दे विल बी नॉट थिंकिंग अपने बारे में वो सोचते हैं इतना ज्यादा सेल्फिश होता है और सल्फर पेशेंट ही वो है जो सबसे ज्यादा सेल्फिश होता है एंड दिस इज द मोस्ट सेल्फिश medicine in our Materia Medica. Okay. And imagine giving wrong things to the people and causing their death. He can give anything to the person to cause the death. Okay. So you can see in the picture that patient is how much he is having a selfish. Okay. While seeing the picture, you can understand the selfishness of the patient. Okay, often great use beginning the treatment of a chronic case and in finishing a acute ones. Okay, you can think, especially if there is a chronic case, then we can think about this medicine. And if you want to prescribe at last, especially in case, then we can prescribe antisoric medicine. And we can think this medicine, if there is a first stage of ulceration over the cornea, you can see. If there is a ulcer over the cornea, then we can think about this medicine. But these symptoms we can correlate with another medicine. If there is a cataract of a office worker, can anyone tell me the name of medicine? Which medicine?
Silesia.
Yes,
Silesia.
yes, very good. Silesia is the medicine where there is mentioned cataract of office worker. Okay. And deafness preceded by exceedingly sensitive hearing and cataract deafness is there. Suppose if the patient is coming to you and that patient is having the problem which is related with the ear, if there is a deafness, means this point we can correlate with the CSOM. If the patient is suffering from the CSOM, chronic suppurative otitis media, then you will find this type of a symptom. Okay, and these symptoms we can correlate with the another medicine cataract deafness and inflammation of the middle ear. Then we can think about the medicine is mug dulcis. Okay. And if the tongue is there with red tip and the borders, you can see tongue white with red tips and white borders is there, then we can think. But if there is an interior part of the tongue is clean and posterior is coated, which medicine we can think? Can anyone tell? The medicine is Nux vomica. Another symptom is that delusion thinks Rex beautiful things, even he is immensely wealthy. The patient is always thinking, even the rags things are there, it will be looking so beautiful to the sulfur patient. And bad effects of the suppression of photoria, what we have said, CSOM. And then we can think about this medicine and these symptoms we have already talked. Drinks much, eats little. खाना थोड़ा खाता, पानी बहुत ज्यादा पीता है. And there will be a pain, especially after drinking. क्या होगा पेट में दर्द होगा कुछ भी लिक्विड पीता है उसके बाद होता है then we can think about this medicine and we can think if there is a itching of the genitals when going to the bed if there is a itching while sleeping at the night and then we can think about sulfur that is brimstone. Okay. Menses preceded by headache or suddenly stop. Suppose if the patient is a female patient is having a menstruation, along with that the patient is having a headache and it will suddenly stop, then we can think about this medicine and these symptoms we can correlate with the another medicine. If there is a catarrhal dull headache is there, then can anyone tell me the name of medicine? Catarrhal dull headache? That is Allium cepa. Okay. And we can think if there is a red brown spot over the body or chest, then we can think about this medicine and this patient will be not sleeping if there is early morning like 2 to 5 a.m. is there, he will be not sleeping, he will be always awake. Then again we can think about this medicine and If the patient is having a pulse, more especially in the morning than evening, then again we can think about this medicine, sulfur. Okay. Now we'll talk about the relationship chapter. Okay. Like if we are talking about the complementary, complementary means complete the action of previous medicine. There are two medicine. One is aloe and sorinum is there. Another is not another like ailments from abuse of metals. Generally सब patient is having ailments from the metals. अगर कुछ metal पहले खाया हो उसने and after that that patient is suffering from any kind of problem, then we can think about this medicine. And this medicine is very compatible with calcarea, lyco, pulsatilla, sarsaparilla, and sepia. And calcarea generally must not use before and after because you know the series. Okay, first we will think about the sulfur and then calcarea, then lyco. Okay, this is the cognate. Okay, and sulfur is the chronic of aconite and follow it well in pneumonia and other acute diseases. Suppose especially a pneumonia is there, then we can think about this. And if there is any acute disease, then again we can think. And this medicine aggravation is there, like changeable of weather is there and bathing and washing is there, then there will be aggravation. And this patient is getting amelioration, dry warm weather and lying down, so it will be getting relief. That is a sulfur patient. And this sulfur we can remember in short by the mnemonic, like by the name of sulfur. S for stoop shoulder you will find and standing is the worst position. And U for uncommon peculiar you will find this patient is hot but aversion to bath is there. Okay, hot तो है लेकिन इसको नहाने नहाना भी पसंद नहीं है. And L for leading burner, try of burning is there, like phosphorus, arsenic, and sulfur is there. And F for philosopher mania is there. Even the rags seem so beautiful. And H for hungry at 11 a.m. And upper part of the body is hot and lower part of the body is cold. R for rush of blood to the head and redness of the orifices is there. Okay. And this philosopher word also we can remember by the name of philosopher. Okay, by the word philosopher we can remember sulfur. P for philosopher mania is there. S for happy dreams and wake up singing. And I for indifferent. Okay, why indifferent? Because sometimes this patient doesn't like that cleanliness, and sometimes that patient will be liking the cleanliness, and sometimes this patient is working day and night, and sometimes this patient doesn't want to work, aversion to work, he will be not doing anything, so this is indifferent. Okay, L for loss of memory you will find. O for opposite of fastidiousness according to the James Tyler King. And S for selfish. O for oversensitiveness, and P for pseudocyesis, what I have already told, and S for hypochondriac. And this sulfur patient is hypochondriac, but that hypochondriac we can correlate with the organ of medicine. So can anyone tell me the aphorism number where Hahnemann has mentioned about the hypochondriac? Can anyone tell?
96.
Yes, 96. Very good. And this patient is very egoistic. Yes, he is very ego. Okay. So egoistic patient, that is sulfur, and he is a religious. R for religious mania you will find. So there are two mnemonic. One is sulfur, another is philosopher. By the philosopher word I have already told. Okay. Just try to remember. Okay. Thank you everyone. If there is any doubt, you can text me. You can ask me.